My personal biggest issue is not having access to the services that you need.
My personal experience is having a daughter with a mental health condition, and I feel for the last 2 years I've battled just to get a diagnosis and to get acknowledgement and recognition of the difficulties we have been going through as a family.
During our first year, we've been focusing very much on developing different mechanisms for people to have their say. First challenge, of course, was people getting to know about us, to actually know what Healthwatch is, what it's here to do.
We're the new kids on the block. There's been voluntary and community sector organisations doing really good engagement work, really understanding the issues that people are facing for years. What we do isn't to duplicate their existing really good work, but actually amplify their voice.
What we want to do is make sure that all members of our community know how to access those services and have a very good experience when they are accessing those services.
We've had significant input into some consultation around walk-in centres locally and the move to an urgent care centre, and what we've been able to get is the voice of those who are seldom heard.
We do enter and view, where we go out to places where services are delivered.
Our first report looked at access to health and social care services for deaf people. Working through the Healthwatch network, we shared our experiences, and it's encouraged other Healthwatches to start looking into those issues.
We work very closely with Healthwatch Nottinghamshire because we share some very large NHS providers.
Sometimes we share attendance at meetings. We've actually employed 2 members of staff as shared posts.
In each local Healthwatch, we've got people who've got expertise in different areas, but we're very small teams. We couldn't all be expert at everything. For example, Healthwatch Rotherham have a brilliant escalation policy. We hadn't even considered an escalation policy, but having seen theirs and thought, that's a good example, let's have a look at that. So through the network, we can share our best practice with each other and gain a bit of support on some of the areas we're not as strong with, but also really champion the things that we are good at and get other people involved with doing those as well.
We've done some work around leaving hospital, and that's also being picked up by Healthwatch England as an issue across the country. And what's important there is that we can feed into a bigger picture and we can really see the strength of the network there.
Regionally, we've certainly drawn huge strength from work with other Healthwatch. It helps us to identify best practice, it helps us to be more innovative in our approaches locally and to share those things that work well.
We've already had a major impact in the community.
One service user told us, for example, that without our service they'd still be sat at home on the sofa not knowing where to go.
We're starting to build confidence and faith that if you come forward, if you share your views, if you have issues with the way that things are done, there are people here who can help you kind of champion what it is you want and make sure that you are heard.
Although there's still a lot for Healthwatch to do, it's great that we can already see some real achievements and that the network is already really working strongly together.
As and when I have done in the past, I haven't been able to get an appointment with see my GP that day or the following day. I've had to wait two weeks, something like that.
We need to change the system so the children that are coming up stand a better chance than us.